Welcome to Action 6 News. We've Zach and Taylor with you, bringing the news. Sorry. Breaking news here. There's been a recent rise in infections of C. diff and MRSA cases in Waukesha County and Carroll College.
C. diff, or Clostridium difficile, is a bacterium that causes severe diarrhea and colitis. It involves suppression of the normal protective intestinal microbiota, which leads to collateral damage, meaning subsequent ingestion of C. diff leads to germination of C. diff spores and growth of toxin-producing cells that change the gastrointestinal epithelium and invoke an immune response. Disruption of the intestinal microbiota leads to decreased competition for limited resources and increased bacterial cell lysis, leading to release of consumable carbon sources. With C. diff, toxin C brings the bacteria into closer contact with the epithelium, possible for a competitive advance or to protect a food source. C. diff has a window of vulnerability for recurrence that occurs as a result of C. diff treatment. The infection can recur when C. diff spores in the GI tract survive despite treatment with CDAD antibiotics and until normal gut flora recover. C. diff can bounce back almost faster than the normal flora microbiota.
That's a lot of information you got there, Taylor.
Yeah.
All right.
Just wanted to make sure we get an in-depth explanation.
Very nice. Our sources are telling us for MRSA, it's also called methicillin-resistant Staphylococcus aureus. It is caused by a type of staph bacteria that's become resistant to many types of antibiotics that would normally be used to treat it. We've been told that most MRSA infections occur in healthcare settings, such as hospitals and long-term care facilities. They typically go with invasive procedures such as device implantations, surgeries, or artificial joints, or intravenous tubing. So we have to be very careful around those, our doctors say. It can also, though, be spread in the community between skin-to-skin contact.
Thanks for the information, Zach.
We got some frontline reporting here. I'm here with Taylor, actual C. diff patient. Let's ask her a couple questions. All right, Taylor, can you tell me a couple of your signs and symptoms?
Yeah, so I came to the emergency room this morning with severe diarrhea and a really bad stomach ache. I started getting a high fever before I came to the emergency department. They decided to admit me to the hospital, and now I am pretty weak. I struggle to get out of bed, to walk around, to get in and out of a chair. So hopefully I'll get stronger these next few days.
Yeah, I hope you get better. Good luck.
Yeah, thanks.
All right, we're here with our next interviewee, Taylor again, but now she's a physical therapist and she's going to tell you all about diagnoses and treatments of C. diff.
All right, thanks for the introduction, Zach. So C. diff is diagnosed from stool samples. We just have to see if the C. diff toxins and bacteria are in them. And it is treated with antibiotics that are listed below me. When working with C. diff patients in the hospital, we have to make sure that we are wearing the appropriate PPE. So these patients have special contact precautions. So we have to make sure that we are donning our gloves and gowns prior to entering the patient's room and washing hands with soap and water after departing their room. We have to make sure that we clean their room and equipment with chlorine-containing cleaning agents, and that the patient remains in the room alone unless healthcare providers need to go in. And when treating C. diff patients, we should be aware of possible bowel perforation, along with possible dehydration, renal failure, and sepsis that can occur. So as a physical therapist working with patients with C. diff, as you heard in the interview before, they're very weak and struggle with functional mobility. So we are going to work with them functional mobility, so sit to stands, bed mobility, and ambulating with them. They might require an assistive device for a while. And also we will work on lower extremity and upper extremity strengthening exercises in bed or in standing. These patients may also be referred to an occupational therapist and a social worker, and then nurses and doctors are already working with them since they are in the hospital. So the prognosis for patients with C. diff are good for the most part. Their fever usually goes away within 2 days, and their diarrhea usually ends in 2 to 4 days. They're also able to increase their strength and activity at this time. Some patients may have a poor prognosis. This is for a very low percent of patients, as their symptoms may recur within 1 to 2 weeks of ending their treatment with C. diff. And just a fun fact to end this information about C. diff. C. diff is a bacteria that can survive on surfaces for around 24 hours or for months at a time as a spore. Unless cleaned and disinfected thoroughly, cross-contamination between patients can occur through hands, textiles, clothing, and surfaces. So we have to make sure that we are taking the appropriate cleaning measures. And now we have frontline reporting patient with a MRSA infection. Here's Zach over here. I'll give it to him.
Unfortunately, I have MRSA. I went to get my knee replaced a couple weeks ago because it was really hurting from some arthritis, but I got a MRSA infection in the hospital where it's common. I'm having some trouble. My knee is really red and swollen. It doesn't move well. It's going to be a longer recovery, but we're just hoping now that it doesn't get into my bloodstream or cause any pneumonia, because the doctor said that would be very bad, and we're going to try to just keep it to the knee and get it treated.
And now we have Zach over here, a physical therapist that will provide you guys with some more information about MRSA.
MRSA is diagnosed by checking a tissue sample or nasal secretion for signs of any drug-resistant bacteria. Some treatment options for MRSA is doctors may need to perform an emergency surgery to drain any large boils or abscesses. These are only emergency surgeries. Sometimes they have planned surgeries to remove smaller, shallower abscesses caused by MRSA. And another option is also treatment with antibiotics, because fortunately, most strains still respond to antibiotics, whether they be hospital-acquired or community-acquired strains of MRSA. When we go into patients' rooms, we want to follow all the appropriate contact precautions. This includes washing hands, glove and gown wearing, covering wounds, sanitizing objects that are going into patients' rooms, and we try to keep the patient in the room as much as possible to avoid any spreading of the disease. So we want to get these people moving around. We don't want them to lay down and lose any muscle strength or mass. We want to work on maybe some sit-to-stands, ambulation, general upper extremity strength, just to keep them moving, active, not sitting around. So a patient with MRSA might be referred to an occupational therapist or a social worker if they aren't already working with them, along with all the other hospital staff that they're currently being treated by. The prognosis is generally good for patients with MRSA. However, it can be a little dicey if it enters the bloodstream or causes a pneumonia, and that's what we really want to avoid and look out for. Well, I, for one, would say that was a very educational news segment we just had. What do you say, Taylor?
I agree with you, Zach. I really hope we don't get them.
Me too.
And to finish this discussion off, Carroll University currently has 250 cases of C. diff and 322 cases of MRSA.
That sure is a lot for a student population of 3,000.